A recent outbreak of listeria has been reported in Spain, affecting pregnant women. A high number of infected persons come from Madrid and Andalusia. These two Spanish regions have declared a serious health alert. The incidence of listeriosis in Spain is highest among pregnant women, with approximately 20% of cases occurring in this population. This is likely due to the increased risk of infection among pregnant women, as well as the severe consequences of the disease for both the mother and the fetus. Even though the mortality rate for listeriosis in Spain is relatively low, with less than 1% of cases, the death rate is higher among pregnant women and their fetuses, with up to 25% of cases resulting in fetal loss or stillbirth normally if the infection is in the first semester. In severe cases, listeriosis can also cause serious illness and death in the mother.
Listeria is a foodborne bacterial infection caused by the bacterium Listeria monocytogenes. The infection can cause severe illness in pregnant women, the elderly, and people with weakened immune systems. Symptoms of listeriosis include fever, muscle aches, nausea, and diarrhea. Listeria commonly is found in soil, water, and some animal products such as raw or undercooked meats, poultry, and dairy products. The bacteria can survive in refrigerated temperatures and can grow in some types of food that are stored in the refrigerator for a long time. The symptoms of listeria infection in pregnant women can be similar to those of the flu, including fever, fatigue, muscle aches, and stomach cramps. In severe cases, can cause meningitis and can lead to serious neurological problems.
Prevention plays a key role in pregnancy. And that's why expectant mothers should take the following precautions. 1. Avoid consuming raw or undercooked animal products, including raw or undercooked meats, poultry, and dairy products. 2. Wash fruits and vegetables thoroughly before consuming them. 3. Cook food to the proper temperature, and use a food thermometer to make sure that meat, poultry, and fish are fully cooked. 4. Store food properly in the refrigerator and avoid consuming food that has been stored for a long time. 5. Wash your hands frequently, especially after handling raw food or using the bathroom. In Spain, during 2019, there was an outbreak of listeriosis due to the contamination of meat. This outbreak caused 3 pregnant women who were hospitalized, 2 in hospitals in Seville and another in Madrid, and who suffered an abortion. These 3 abortions joined those of 2 other pregnant women who also lost their babies before the health alert was decreed and who ate meatloaf from the brand responsible for the outbreak. The 3 abortions registered in Seville and Madrid occurred in the first trimester. Of the 27 pregnant women infected by this outbreak of listeriosis, the majority gave birth to healthy babies, although the abortions also show that the treatment does not prevent this from happening, said the cabinet spokesman for the Ministry of Health for this outbreak of listeriosis. Spanish authorities took action to contain the outbreak, warning and conducting more research to determine the source of the listeria contamination.
Antibiotic therapy is the primary treatment for listeriosis in pregnant women, with ampicillin and gentamicin being the antibiotics of choice. Other treatments, such as hospitalization and delivery of the fetus, may also be necessary, depending on the severity of the infection and the health of the mother and the fetus. In conclusion, listeria infection can have serious consequences for pregnant women and their fetuses. Expectant mothers should take steps to reduce their risk of infection by avoiding raw or undercooked animal products, washing fruits and vegetables thoroughly, cooking food to the proper temperature, storing food properly, and washing their hands frequently. If you experience symptoms of listeria during pregnancy, it is important to seek medical attention promptly to minimize the risk of serious health problems.